Welcome everyone today on the next webinar that we are hosting for Infra for Next Generation. And today's webinar will be about exploring secondary and archival data in social science research. And I would like to really warmly welcome our speaker of today's session, Cara Booker, who is coming from ISER at the University of Essex. Dear Cara, floor is yours, and I'll help in the back. Thank you.
Thank you very much. And thank you for having me. Thank you all for attending. As Ariana said, my name is Dr. Cara Booker. I am a social epidemiologist at the University of Essex, and I am obviously here to talk to you about archival and secondary data. So some of the goals of this presentation are to know where to look for secondary and archival data, social science data in different data depositories, discuss some of the advantages and disadvantages of using this type of data, and to better understand what kinds of research can be carried out using mostly secondary data. I'm not going to talk too much about using archival social science data, but more about secondary data that I have conducted in some of the analysis that maybe you can do in the future. So what is secondary or archival data? Well, archival data is data that hasn't been collected for a specific research purpose, but has been stored. So some of these examples are government records, other institutional records like medical records, company documents, photographs, videos, audio recordings that are not specifically for research, things like personal communication. So you often see archival documents such as letters or other types of personal communications, maps, furniture. It can be really anything that is now stored that is that has been stored from the past. Secondary data is data that is collected for a specific purpose. So it's collected for researchers or by researchers for a specific purpose. However, it can be used by others, other researchers for different or similar purposes. So you have things like cross-sectional or longitudinal survey data. You've got qualitative interviews. You have photos, images that were collected for research purposes. You have things like biomarkers or genetic data, other types of blood markers, etc. So why would we want to use secondary archival data? Well, archival data is virtually impossible to collect currently because in its nature, it is historical. It's things that have happened in the past. So you can't really go back and collect, or you can't collect archival data in the present, as it were. Secondary data, there's a few reasons why we might want to use secondary data. Mostly it might be more economical to use. If you are wanting to collect your own data, you have to think about what kind of sample you have. You have to think about what funding sources you have. You have to think about how you do your sampling, how much time you have to collect data, how realistic that you can get the number of people that you want. And if you have secondary data, you might be able to find data that will provide you with a more diverse or larger sample that has already been collected than you might be able to collect through yourself. By yourself, and the data might have a longer time frame, meaning that you can conduct longitudinal analysis. So if you can only collect data over a period of a year, you might be able, depending on how you're doing it, be able to get, say, 2 annual, one at the beginning of the year, one at the end of the year kind of data collections. You could do every month if that's the kind of data that you want. However, if you're looking for a much longer time frame, might be able to get data that's 20 years old or 10 years old and have a much more rich data set, have many more observations to test the hypotheses that you're testing. It might be able to get better quality through secondary data if you're using some of these large data sets that have a lot of funding behind them that are able to navigate some of the pitfalls that you have in collecting primary data, so the quality of the data might be better. You can use that data to reproduce results from previous studies. So some studies will use the same data set and you can go back and you can reproduce it. Or you can use a secondary data set to reproduce findings from a study that used a different data set or something that you've already collected yourself through primary data. And that can also reconfirm what your findings are. If you find differences, you can start to explore why that might be. And finally, you can analyze the same questions with different statistical methods or addressing statistical assumptions that might not have previously been addressed. So sometimes you'll see that a question has been answered using a specific statistical method, for example, OLS, so basic linear regression, and you think maybe I should be using fixed effects models or random effects models because they address some of the assumptions that were not addressed earlier. And rather than collecting your own primary data in order to do that, if you're using some kind of fixed effects or mixed effects models needs to be longitudinal, you might be able to find a secondary data set that will allow you to address those issues. So where can you find these secondary archival data? Firstly, a lot of them are stored in digital archives like CESSDA. Here's a list of archives around the world where you can find different data sets. We have the UK Data Service, that's where I'm from, and I'm most familiar with those, but there's also many more like ISER, of course, CESSDA, the Roper Center in the US, etc. Some other sources of secondary or archival data are libraries. Libraries often have lots of archival data in them, museums, of course, and study websites themselves. So some studies choose not to deposit their data into archives such as CESSDA, but they do allow access of their data through their data set, or sorry, through their website. So the European Social Survey is a good example of this. If you go to their website, you can find out how to access their data. The study of health and aging in Europe is also another study, SHARE, which you can go and you can find download their data. You can download specific countries or you can download all of it. And in some cases, there might be a small fee. In some cases, you might have to fill out an application form that will then need to be approved. But usually the form and the approval process is pretty smooth. So do check that out before you decide which data sets you might want to be using. Another thing about digital data archives is that they offer a lot more than just a repository for the data. There's lots of training opportunities, for example, how to use the data, kind of introductions to different statistical techniques. If you have data that you want to deposit into those archives, they will have training about how you actually get your data prepared in order for them to be able to archive it. There's lots of study documentation, and where possible, there will be links to studies. Sometimes if they have data that's quite old or where a study did not have a website, there won't be anything there. A lot of archives have variable or data catalog searches. So if you're looking for a specific variable and you don't know which data set might be the best to use, you can go in there and type in what you're looking for, and you will get a list of studies that have that either type of variable or something similar, and then you can go through and have a choice of what might be most appropriate for your research question. There will be information on how to properly cite data, and then they'll have other types of events around either when data gets released or events like this webinar, and other kind of informational events. And then, of course, they have publications, whether they're publications about the archive itself or about reports that researchers have worked with the archive to develop. There's all sorts of things. So the archives are actually a really, really good source of learning more about data, but also about research processes, about archiving processes. So I encourage you to go and have a look around their websites. So now I'm going to talk a little bit about how we go from having a research question to analyzing the data using secondary data analysis. And a lot of this is based on, I think you got the link to it, a book that a colleague and I, Tarani Chandola, wrote. So you can get a lot more detail in that book if you want more information. So I'm going to start with the research question that I've been working on for a while, and that I can kind of show you what the process that I went through. And this is about how digital technology use is associated with adolescent mental health or well-being. So this is something that I'm interested in. People are talking a lot about in the UK and throughout Europe. How do we protect kids, but also how much of an impact is being on screens or being in social media impacting young people? So why might I want to use secondary data over primary data? Um, Firstly, getting data from young people can be difficult. They are more reluctant to participate than older adults. It can be a quite complex consent procedure depending on their age. You're going to have to get parental consent or their responsible adult consent as well as their consent. And consent's very important, so you need to make sure that you're following the rules of the country or the federation that you're in. Accessing young people can be difficult. You usually need to go through schools or other spaces where young adults are hanging out. If you're going through schools, that might mean that you need pre-existing relationships with them so you understand the rules that the schools have in place for data collection, but also having a relationship with them means that they're going to be a little bit more willing to help you when you have problems or when you need to access the young people within their care. And it can be quite costly, obviously, to do primary data collection. You're going to need to produce all the consent materials. You're going to need to produce all of the questionnaires. You're going to have time in order to do the data collection. And so you might say, I can't get the funding for all of this, or I can only get funding for bits of this. How about I use secondary data? Most data available in archives are free to academics. They do require a registration, but once you get in there, it is, you're able to go in there quite quickly and download the data that you need. Most archives also have several levels of access. So different levels may require stricter computer or secure server requirements. So most access is end user license, and that gives you all data that is sometimes certain things might be omitted or certain variables might be coded differently. So for example, they won't give you month and year of birth. They might only give you year of birth, or they might not give you the full range of ages. If you're looking at a general population, they might code, say, everybody over the age of 85 or 90 as 90. And that way, because there are so few individuals who might be over 90 in a particular data set, you can't identify people by their age. So they will keep out some of these. They will ensure that identification is not possible. As you get into higher levels of access, you can get more information. So you can get, say, the month of birth or the month and day of birth. You might be able to get specific addresses. But as you get up to those higher levels, might have to access the specific server where your computer is not online. You might have to go into an archive itself and get into a specific room where they have much stronger controls over what you can and can't access. But all of that information is in the archive. And in using secondary data, you can ensure that confidentiality has been checked. So a lot of the preparation for depositing your data has to go through making sure, as I just mentioned, that the individuals are not able to be identified, and they have lots of checks to ensure that this has been thoroughly vetted. So now I want to think about the constructs. What variables do I want to try and see what data set that I'm looking at has? So I've got two major ones. One is digital technology, and there's lots of ways to define digital technology. I can use of screen time, so how frequently are you on, the number of days that you're using screens. I could think about using social media, so what platforms am I using? How often are you using specific platforms? You have types of devices, you have activities. So there's, are you posting? Are you just reading? Do you use it for schoolwork, etc.? Your experience on social media and digital technology spaces. So are you making friends? Do you have experience around cyberbullying or unwanted attention? All of these things. And depending on what my research question specifically is, I might want just one of these, I might want all of these, and I need to think about how I want my construct defined, but also think about what data sets might have each of these different types or might cover each of these different definitions. And then again, with mental health, there's lots of ways to define mental health or to measure mental health. And this could be through measurements of depression or anxiety. You can look at self-esteem. You can look at body image. You've got subjective psychological well-being. And again, there are different measures within each of these different definitions. So it can get quite complex. But if I'm just going to stick to use of screens, say, and anxiety as my main, or subjective psychological well-being as my main constructs for this example that we're going to talk through. The next thing I might want to think about is the population definition. Who do you want to generalize your findings to? Are you just looking to generalize your findings to young people in the UK, or do you want to go wider? Are you looking at specific subgroups? Are you looking at specific ethnic groups or subpopulations? How might the sampling scheme of different studies impact your generalizability? So are they using a random sample? Are they using convenience samples? Are they just, getting anybody that wants to volunteer? And what is the geographical coverage? Are these national samples? Are they specific to a specific region within a country? Are they specific to, say, the 3 or 4 largest cities in your country? These are things you need to think about that will help you understand how generalizable your findings are. And the second thing is the unit of analysis. So these are considerations for what is relevant for your dependent variable. If I'm looking at well-being, I want to have a unit of analysis that is at the individual level. I could look at population level, but then my analysis will have to be shifted. So you need to look at what your unit of analyses are. And if you're doing something hierarchical, you might have, 2 levels of units, as it were. If you want to compare groups, you need data information on all groups. So if I want to look at the differences in social media use amongst boys and girls, I'm going to need both boys and girls in my data set. And some of the unit examples I give here, I talked about. So you can have individuals, you can have schools, you can have regions or countries. If you're doing something more clinical, you might have hospitals or clinics, something like that. So now I've thought about what my research question is, what my constructs are, what my unit of analysis might be. I think now I'm ready to start searching for data sets. So where do you start searching? Um, One of the first places is the literature. If you've been doing your review of what other studies have done, it might be a good idea to just take notes of what studies have been used to address your research question, what data has been cited. If you're looking at a review paper, that's always a good place to go and see what data they have used, and you can start thinking or looking it up and seeing what they might have available. Study websites. If you have a study already in mind, you might want to go to the study website and look at the documentation. If it's a large enough study, they might have a variable search where you can just start typing in keywords and it will show you what variables are available. They should have publication libraries, or at least a list of publications that have come from that study that you might go and look up. You can use AI to compile a list of data used for specific types of studies or using certain variables, questions, or topics. And of course, you can look at archives, which we've discussed, but we'll also discuss in a couple minutes. Some considerations for when you are going to search in data sets is to keep track of keywords to help streamline searches. So for example, if I am going to search for mental health, I'm going to get, as you saw in that list, an even wider list of things that cover mental health because it is a very broad category and there's several different ways of measuring it and different definitions within mental health. But if I'm really interested only in depression, or if I'm really interested only in anxiety, then I need to be much more specific. So as you're thinking about what constructs and what parts of constructs you might want to measure, just keep track of those keywords. If you're looking for income, are you looking for personal income or household income? If you want education, or you want years of education, or you want their highest educational attainments, if they have had a degree or not. Some of these things being quite specific will help you narrow down how many variables you might get, or if they actually have that variable in that data set. You want to know what the sample size of the data sets that you are looking at or considering to use, and also consider subsamples. So it might look like there's a large sample, but when you say, I want to look at boys versus girls, is that going to be adequate sample size for the analysis that you want to do? Or if you want to look at different ethnic groups, or if you want to look at LGBT groups, do you have enough of the group itself, or if you're breaking it down even further within that group, is the sample size large enough for you to conduct that analysis? You might want to look at the age of the study or the data collection period of the study. So sometimes you find a really interesting study and you say, I want to use this, but then you start thinking about the age of the study. So the data was collected, say, in 2010. Now, that's not too long ago, but that's still 15 years ago, and things have changed a lot since 2010. So what might that data not be able to be generalized to today's day and age? What about that data might be quote unquote out of date? So you might want to think about that. And that doesn't mean that you cannot use that data. It just means that when you're interpreting what the data is, you definitely need to take into account the age of the data and how interpretable that is. Um, obviously the region and country. So where does the data come from? What region does it cover? And the level of access needs. So do you need anything that might be considered more sensitive? Do you need geographical identifiers? If you do, how specific do you need them to be? Do you want specific addresses because you're linking to something else, or is regions large enough? Do you need things like biomarker data or genetic data? And if so, then you're going to need to think about what kinds of applications you might need to be put on. If you're a PhD student, most applications that require higher level access are going to need input by your supervisor. So you need to talk with them about what they need to do for the application. So now we've thought about all of these and we're going to actually start searching. So I searched data archives for data with young people. I looked at what questions were asked. If the data is longitudinal, you might want to think about how often questions are asked. Sometimes questions aren't asked every year. They might be asked on a rotating basis. So you need to know that so that you can also take that into account when you're thinking about how you're going to analyze the data. How many waves or how many years of data do you have actually for specific variables? What other data is available? So I'm looking at young people. I want to have some data from their parents or on their parents. How much information can I get about their parents? Some demographic data, both for the children and their parents. Is there anything about regional data that's available? When you're using secondary data, and for the data sets that I'm talking about, they are very broad in their scope. So they are much more, ask a lot of questions from a lot of people about life in general. Sometimes you'll come up against a data set that is very specific in what it was originally collected to do. It was collected for, say, clinical data on young people with, surviving cancer and their experiences. That's a very, very specific data set, and you need to understand, say, what the assumptions underlying that research, how that might impact your secondary data analysis, the research questions. Sometimes it might be hard. Or impossible to actually answer your research questions with specific types of secondary data because that data either didn't collect the information that you're looking for, or there's not enough people. The purpose of that data set was not what you wanted. So for taking my example about digital technology, I might be able to use a data set on young people and their cancer experiences if they ask about their mental health, if they ask about their data, digital data use. But then when I'm interpreting the data, I have to think that this is about a very specific population. And so this findings might not be generalizable to all young people. And it might not even be generalizable to all young people who are experiencing cancer if they only looked at specific types of cancer. So these are the things that you might need to think about. What was the original primary research focus? What types of metadata are available? Do they have code books, questionnaires, and do you need any other types of data? You can have all this information usually available about the actual data collection process. So the time of interview, the length, the how they contacted them, how many times, etc. So I selected Understanding Society because it's a data set that I work with the most. You can find this through the UK Data Service. It's a nationally represented data set where individuals in the household are 10 and older are interviewed annually. There's a youth data set for those 10 to 15, and then adults 16 and over make up the main study. There are alternative data sets that I thought about also using. There's a Millennium cohort, so that's a UK birth cohort. And here you can see that the data hasn't been collected as often. One of the advantages of this data set is that it's large. It has a large ethnic minority sample. It has good digital, technology and mental health measures, the variables that can look at mediation. But as I just mentioned, there's somewhat of a large gap between data collection periods. So if you think that it's important that you look at, say, what's going on in more detail in teenage years because of the developmental questions you might have, this might not be the best. And another alternative data set is EU Kids Online. This is a repeated cross-sectional, cross-national survey of children 9 to 16 in Europe. Here you can see they collected data twice, once in 24 European countries, once in 19. The advantages is that they have really detailed information on online behaviors, including device use, cyberbullying, rules that parents make around use. It's a really large sample. It crosses many countries, so you can do cross-country comparisons. The disadvantages is that it's a bit difficult to access the data. They really don't have a lot of parental information. They have very little or very basic mental health or well-being questions and quite basic sociodemographic questions. So it's basically, I think, limited to age and gender. So once you get to know the data, some of the things that you have, that now that you've downloaded it, you need to explore the documentation. So get familiar with how it was sampled, and what those different sampling schemes might mean for your analysis, but also for your interpretation. Again, what questions are asked and how often are they asked? What's the response rate? If you're using a longitudinal study, how much attrition is there overall, but also year on year? And whether there are boost samples, whether they've added more people through the study overall to either make it more representative or get the sample size up. What are the missing value codes and what do they mean? Again, what's the study context? Is it cross-sectional? Is it a birth cohort? Is it a panel? What the unit of analysis is going to be for that. You need to determine, obviously, you've thought about this before, do you need other types of data? So you need to determine the access that you need. The format of data delivery, usually when you go into an archive, you can choose what format you want the data delivered to you. Mostly it'll be in Stata, SPSS, or ASCII, or some kind of tab delimited. Sometimes, depending on which data archive you get, you can get a SAS file or an R file. You need to look at the data structure. So sometimes you can just get one file for a study, everything's in one file. A lot of times, particularly in longitudinal studies, you're going to get a lot of data files, and you need to know what's in which one. So you need to know which, either if you can download them individually, which files you want to download, if they all come together, which ones then you want to use for your analysis. They might have different files that have different types of data. So in Understanding Society, for example, we've got a data file that's just for income data, or a data file that's just for the newborns, information about the newborns born in that wave. If you're getting one file that is for the data, all the data set, is it in a wide format, a long format? And what are the unique identifiers? What are the identifiers that identify in each individual, or the households, or the schools? And if it is a longitudinal data set, how do you identify people across time? You need to think about the naming convention. So how do studies name their variables? Are there different prefixes or suffixes that identify different types of individuals? So, for example, if there are proxy respondents, and proxy respondents are respondents where somebody else answers questions for an individual who's not able to answer a survey or be part of a questionnaire, how do you identify them? If they're, say, for young people, do they have a specific identifier on the variable name that identifies that this was just asked to those groups of people? Are there topics or modules that have maybe similar variable names? So if the topic is around income, does everything in that start with INC or have some kind of identifier attached to that? The universe of the question. So who is the question applicable to? Who asked this question? A lot of times everybody will ask a question, but if you don't have any children, do you then not have to answer any of the children questions about children in your household? So who answers those questions? Are there screening questions? So are there questions that, as I just said, might get asked additional questions? So if you are asked, do you have any medication, and you say no, you're moved on. If you say yes, then they might ask you the types of medication. And this is tied to the universe of the question. And then finally, are there any derived variables? So are there variables that the the study produces that are helpful for you? So sometimes studies will produce like a total income, or they will produce scales that are summarized in a specific way, and you can get the total scale. Sorry, I'm going to move a bit faster because I realize I'm going to uh, run out of time soon. The next thing is around data management and how to use a buildable data set. So you want to select the variables that you want to use. A lot of times, data will give you a lot more variables than you want. And if you just kind of put them all into your stats program, it'll slow it down because of the number of variables. What kind of data structure do you need? Do you need a wide data structure for the analysis that you're doing, or do you need something in a long format if you're, say, doing panel analysis? And as I said, some data have many files, so you're going to need to combine them, and you're going to need to understand how to combine them. Then you need to start working on specific variable management. Some of the common problems that you might come up with are descriptions for variable labels not being there. Sometimes the variable names change between data collection periods, and it's kind of hard to understand that. Are there skip patterns? This goes back to the universe of questions. The questions that are tick all that apply, how are those coded or given to you in the data? Are you given a data set that has individual dummy variables? Variable options might change or not be consistent over time. So for example, if you're living in the UK, they change the regions, number of regions in area, or how they kind of name them, that might change. There's things change to codes that are standardized, so occupational codes might change over time. If you're looking at diagnosed medical conditions, when COVID happened in our study, we had to have a lot more diagnosed medical conditions for those people who might be more susceptible to getting COVID. So things like that. Data management takes a lot of time, a lot longer than you expect it to take. So be patient. It's really important that you really understand your data in order to get the best out of your analysis and how you interpret your analysis. AI is a really helpful tool for coding. Asking others for help, particularly those who are familiar with the data set, is really useful. They might have tips and tricks for addressing certain issues. They might think about things that you haven't thought about. Always use a copy of the raw data to do data management to avoid overwriting permanently the data that you've downloaded. Use code editors, save your data management. Write notes to yourself either in the code or in, on paper or online. So some examples of how I've used data to analyze secondary data. So using Understanding Society, as I said, it's a longitudinal study. The unit of analysis is individuals. You can also do it by countries or regions. Data is collected annually. It's got a very complex sampling scheme, but overall it's clustered, randomized, equal probability, and you're also giving weights to address some of these issues. And I'm using the end user license data. So online, you can get all sorts of information. Here's a link to the user guide. Here's a list of just some, not all, of the different types of data files that you are given and the description of what's in them. Here's an example of the missing value codes. So if you see any of these in your data, this is what it means. For most of the time, the most important ones for this data set are to look at -8, and that's not applicable to that person because of routing, which means that they were asked a question that they answered a specific way to, and then they were not asked follow-up questions. So you might need to do something about that. Here are some of the key variables. So here you can see which variables are used to identify individuals or waves, some of the sampling or interview variables, a couple of just variables about key demographic characteristics. And here's a much longer list. This is not an exhaustive list. They have a lot more on here. I just thought I'd pull some of these out so you can have an idea. They also tell you what data files are in and just give you a brief description. So if I am looking at digital technology questions, here are the 3 questions that they ask. If they belong to a social website, how much time is spent on chatting, playing computer games using the internet, and their frequency of use. So if I'm looking at young people 10 to 16, here's the pattern of social media interactions for girls. And you can see that as they age, they begin to have more of them have a profile and they use more social media over time, which is expected. And similar pattern with boys. The difference is boys are much less likely to use social media in the way that it's defined here for 4 or more hours. Most of them are only using it less than an hour, 1 to 3 hours. Here are the well-being questions that are asked in Understanding Society. They ask about happiness, and they ask the Strengths and Difficulties questionnaire, which is a mental health questionnaire. And here's a little bit of detail about it. Here's some information about how these change over time for SDQ and happiness. These are the covariates that we included. And finally, here we have some of the cross-sectional analysis. So you can see the odds ratios. The more you use, basically the patterns are the more you use, the less happy you are, or the more difficulties that you might experience. And then just briefly longitudinally, this is the model. So we're doing growth models, and basically what we found is that girls were more likely to have total difficulties if they used a lot of social media when they were 10. By the time they were 15, their mental health was much lower than those who didn't. I'm sorry I had to rush through the last part, but I realized I wanted to save some time for questions. So finally, here's a recap. Primary data is derived from research interests, usually collected by the researcher themselves. You have a bit more control over the content and design of the data your collection. It's going to be more up to date because you're collecting it in real time, but there are also considerations. Whereas secondary data is derived from primary data. It's a bit easy, it has easy access, fewer of the primary data considerations. You don't necessarily have to wait for longitudinal data, but you do have to consider the reliability, the relevancy, the fit to your specific research questions, and the age of the data. So thank you very much, and I am open to answering any questions.
Thank you, Cara, for this really interesting insight of all the elements. I'm sorry that we didn't have more time because I would really be interested in seeing this last analysis, me having kids, how it actually influenced all of that. But yes, I would like to invite again everyone, if there are any questions, to put them in the Q&A session. You can also raise your hand and we'll unmute you. But until then, until colleagues, yeah, and participants figure out if they have anything, what would you say? I had seen that last calls of European Commission really recommend reusing the data, because it is something that we at data repositories and service really kind of urge, people try to reuse. There's so many out there. And you had given us really great examples on how this could be used. But I was just thinking, joining, I see in the list many researchers, but what could we as data repositories do to make it easier, perhaps for researchers? Is it documentation? What I think would be something that you recommend for us as repositories?
I think it might be documentation. Sometimes it can be a daunting to go into a data set and have to look at if you have nothing about the variables. Can I search by something as broad as social media? Do I have to have something specific that's in the title of or the label of the question? Because sometimes they don't really match, right? Um, I think having examples of how the data can be used is a really good thing. So either links to papers or links to and a wide range. So something like understanding society, we can have things about families, we can have things about young people, we can have things about education, we have things about health, like highlighting the different at least topic areas that a data set might cover. So if I go into a data set, I can automatically see, okay, it talks about health and it's got young people. That's going to be something that I'm interested in. Versus if I have no idea, then I have to do a lot more searching about, what's in that data set. So that might be helpful. Um,
Yeah. So,
yeah.
yeah, so few explanations about, and as you said, yeah, linking reports and documents. I see there are two questions also in the chat. So let's see. There was a question: did you experience a lot of missing values when working with the data set? If so, how did you approach the missing values?
So that really depends on the types of data. Again, if there are skips, so one of the reasons why I'm really adamant about understanding the universe of questions. So if you go into a question and you say, I want to look at, so for example, on here, I looked at social media and how much you're chatting on social media. The reason why I included the question about do you have a profile is because anybody who doesn't have a profile is not asked the questions about how long are you chatting on social media? So you're going to have a lot of missing, particularly as you can see at 10 years old, only 50% of them had a profile. So 50% of 10-year-olds are going to have a missing value on the questions about how often do you use social media and the frequency of use, right? So that seems like a lot, but if I can combine them, then I get a category for those people who have no profile, which then brings in all of that information. And then those who have a profile, I have information on. So there are might be ways of getting around missing values if there's a screener question. If it's just missing because they didn't want to answer that question, then there might be other ways. So you can look at multiple imputation. There might be things around weighting that you can use to address these. So there are some statistical ways, but also there might be some data management ways of getting around hopefully some of the missing values so that it's not too much of your considerations when you're doing the analyses or when you're interpreting.
Yeah, and I think actually our second question kind of links to that,
Mm.
because there's a question of how many cases should at least be in each group if you want to compare the groups in a data set. I think that's actually dependent on the what kind of statistical analysis you will do. But it is, yeah, true that some of the groups will be less represented. So it's always kind of a challenge of what you do, but I think it's with larger data set that would cover larger population, not just a few hundred, I think it's then easier. But I think you addressed already this at the beginning. But if you have some recommendation further.
Yeah, it really does depend on the type of analysis that you're going to do. So if you're kind of doing some kind of structural equation modeling or path modeling, they say at least 20. Um, it also depends on how many other variables you want to add to your model. So if you're doing a very simple model that's got fewer variables, you might be able to have smaller groups. But if you want to have lots of covariates or mediators, moderators, you're going to have a much larger because you need to have that sample size. So yes, I would say definitely have a think about the analysis that you're doing. Also, how many parameters you're estimating or how many other variables you have in your model. Um, there's no one size fits all for that question. It really depends on what you're doing.